Welcome to Devex at the 77th World Health Assembly, a special edition of This Week in Global Development. My name is Rumbi Chakamba. I'm an associate editor at Devex. This year's World Health Assembly is a pivotal moment for global health security, with countries working to finalize a pandemic treaty and amendments to the international health regulations, which are a legal framework for handling cross-border public health emergencies. This has been an ongoing process where some countries are hoping to right the wrongs exposed by the COVID-19 pandemic and ensure that the world is better prepared for the next outbreak. But negotiations have not been smooth, casting uncertainty on whether the process will result in agreements that promote equity and global solidarity. Throughout the week, my colleagues and I will peel back the curtain and take you behind the scenes at WHA as we speak to the people shaping the future of global health. During the COVID-19 pandemic, African nations were at the back of the queue for medical countermeasures, including vaccines. This led to a resounding commitment from the continent's leadership to ensure this never happens again. While there's been a lot of work done to build new structures and enhance existing ones on the continent, there's also a need for changes within the international global health system in order to ensure the health of the population of over 1 billion people on the continent is protected. In this episode, Devex Senior Global Health Reporter Sarah Jerving speaks with Dr. Gitinji Gitahi, Chief Executive Officer of AMREF Health Africa, and Dr. Magda Robalo, President and co-founder of the Institute for Global Health and Development, about the changes needed at the international level.
Dr. Robalo, what are some of the key barriers that exist at the international level that are holding the continent back from increasing its global health security?
I would say there are several barriers. One of them is certainly the decrease in funding from overseas development assistance. As you know, we had been observing a decrease in financial assistance. It was estimated at 58.7 billion in 2021, dropped to about 54 billion in 2022. And this is also concurrent with increasing debt distress following the COVID pandemic. Most African countries found themselves in a very tight fiscal space. This is on the financial side. There are other elements. For example, if you consider escalation of conflicts and unrest, civil unrest in several countries, if you consider the fact that African countries have competing priorities from food insecurity, health systems issues, democratic challenges in several countries. So all those compound the challenges from African countries to get their health systems fit for serving the people, but also secure health security. I should also add to this the fact that the global governance architecture is not conducive for a post-COVID-19 pandemic environment, and that is an issue that we also need to consider.
And what sort of changes would you like to see out of the international community?
There are several issues that need to be considered. One of them, and which I consider paramount, is the global governance architecture, both on the economic and financial side, but as well on the health, global health governance. I think we need to do the necessary changes that will empower African countries to be participating more effectively in decision-making when it comes to global health issues, when it comes to financial and economic issues, so that they could finance the health priorities that they have defined for themselves. I also think that the development and deployment of health innovations need to be done in a more equitable way, right from their design down to implementation levels with equity lenses in mind. We need to be looking into the very thorny issue of intellectual property rights to enable African countries to be producing the diagnostics, the vaccines, and the medicines they need, the innovative tools they need to leapfrog the health systems. We are going through a very polarized world with challenges that influence not only ODA, but also influence the ability of African countries to negotiate to their favor some of the financial and priority setting that is required. I think another important challenge that we are facing in the global health landscape is antimicrobial resistance from misuse and overuse of antimicrobials for treating disease. This is an area where increased convergence, increased coordination, not only within the health sector, but on a multi-sectoral basis. We need to work together. Countries need to come together to agree on the steps that are critical and important to reduce the development of antimicrobial resistance, and universal health coverage is critical for that. If we don't work towards universal health coverage, AMR will continue to be a challenge.
What would you like to see from the international community when it comes to adapting to climate change? How would you like to see the international community step up in that regard in the coming years?
Climate change is disrupting African countries in many different ways. What I would like to see coming forward is really an increase in adaptation financing. We need to prioritize climate change adaptation financing so that health systems could be designed in order to cope with extreme weather events like floods and the increase in waterborne diseases. We have seen increase in malaria cases. We also need increase in adaptation financing so that we can deal with food insecurity that derives from climate change. But critically and importantly, we need research and development of tools. If I think of malaria, for example, we need improved factor control and a new generation of malaria prevention tools, new medicines to accelerate elimination and protect populations from climate-induced malaria, but also other waterborne diseases.
And what are you hoping to see out of the World Health Assembly this week?
It is going to be a World Health Assembly where every opportunity for us to do better as a global community is there. The chances are that it will be a World Health Assembly that will regret missing opportunities to do better as countries of the world. What I would like to see is that countries will agree to continue negotiating the pandemic accord, because a bad accord is definitely not good. I would rather have no accord than a bad accord. I would like to see countries coming together and deciding that it is critical to strengthen global health security and we need a more coordinated and effective response. So agree on steps on the roadmap to achieve a pandemic accord that will be equitable, fair, and transparent. I would like to see the social participation resolution that is tabled to the World Health Assembly to be agreed upon so that we see increasing levels of social participation in decision making. I think that will help us improve the status of governance that we have right now. We are on the same boat and we need to work together to make the world a safer place, and that global security is a goal for everyone. And a give and take has to be critical. Those who have more, those who can do more, should agree to give in order for us to meet each other at a level where everyone will feel safe. So it is a make and break World Health Assembly, if I can put it in those words.
The world is facing a range of health threats, from an increase in disease outbreaks to the health impacts of climate change. I'm Magda Robalo, Senior Global Health Reporter for Devex. Every Thursday, we bring you exclusive news and insights on how the health sector is finding solutions to these challenges in our free weekly newsletter, Devex Checkup. Visit devex.com/newsletters to subscribe.
We also asked Dr. Gitinji Gitahi, CEO of Amref Health Africa, what sort of change he wants to see out of the international community. A key area for him is funding.
This has been a really hot issue, I would say, for very many years, especially all the way from the founding of the Millennium Development Goals that kind of gave a structure to donor financing. There was the intention that because the agenda of the Millennium Development Goals was shared, reducing child mortality and morbidity, maternal mortality, reducing infections for HIV, TB, malaria, all those things that were stated, including ending poverty and malnutrition. They were joint agenda. But what happened is that the international community in its response chose what was applicable to their local politics, their local development agenda, and what their money would align to. The money has not followed the global agenda. The money has followed the donor country or the donor entity objectives, interests, and strategy. So, you will see, of course, that part of what has driven this is the ability to account for the money that countries are using from their taxes, the ability to account to the taxpayers, and those taxpayers represented by their parliaments, Congress or otherwise. And that therefore has limited the agility and the flexibility of the money because it is structured towards an accountability framework back home. That has been a major problem. And that applies also to the multilaterals, not just the bilaterals. International development assistance has been of great help to reduction of avoidable mortality and morbidity in the continent. There has been huge gains in child mortality, huge gains in maternal mortality, and those are to be celebrated. At the same time, there have been bottlenecks. Those bottlenecks are about sustainability. That in order to actually make this change that I've talked about, the positive change, to be sustainable for a long time, then we must ask ourselves, what's the foundation that is actually going to sustain this? The foundation is not only buying commodities for HIV, TB, or malaria. It's not just about buying mosquito nets. It's about also ensuring that there are health workforce or human resources for health that sustain, the prevention and the promotive part of this, that sustain the care and treatment that is needed. You find that some of the international money will come and support health workforce specifically for the area that the money is coming for malaria or for HIV only, rather than develop human resource capacity for health in the country to ensure that a country has a good foundation on human resources. Donors may say, well, we committed this to our taxpayers, we committed this to the donors, therefore we can't change our strategy because even if that's what the country finds scientifically and evidence-based that it is what is going to work, we can't change it because our taxpayers did not agree for us to change. So basically asking the question, who is leading the priorities and who is approving the priorities? And therefore having that question around the country ownership. And this is what has led to the conversation on the future of global health initiatives. And the future of global health initiatives is asking for more closer alignment to countries' plans, more closer alignment to countries' national financing agenda. We need the national countries that are receiving the help to be stronger in guiding how this money is used, to actually realize that this money is not just charity, it is actually development assistance, not charity. And that development assistance must be aligned to the country's needs for it to actually be development aligned. The agenda on global health is not an agenda for Africa. It is an agenda for the world. So that we don't see it as, when we're asking for equity, equity is not charity. is not equal to charity. Equity means let us do the right things for all of us, but do it with an equity lens, that we start with the most behind. That's why Africa is on the table, because of the most left behind. Africa has the lowest access to health services. Africa has the highest burden of disease. Africa has the lowest density of health workforce. So we are not doing it for Africa. We are doing it for the world, but equity demands we start with the most vulnerable. So I think that message should be clear, that equity is not charity.
Thanks for listening to Devex at the 77th World Health Assembly, a special edition of This Week in Global Development. If you enjoyed today's episode, please share it, or you can also leave us a rating or a review. We'd also love to hear from you if you have any feedback or want to get in touch. You can find me on social media at @rumbichakamba_, or send an email to podcast@devex.com. Devex at the World Health Assembly is hosted by me, Rumbi Chakamba. Today's episode was produced by Naomi Mihara and edited by Mai Ilagan.